Welcome to the webinar and book launch of the Security Sector and Health Crises at the Global Health Center of the Graduate Institute of Geneva in partnership with the Geneva Center for Security Sector Governance. Thank you for joining us this afternoon. My name is Anne Bennett, and I'm the head of the Sub-Saharan Africa Division of the Geneva Center for Security Sector Governance, and I will be moderating today's event. This joint project between our two institutions was launched against the backdrop of the Ebola virus disease in 2014-2015 in West Africa, which had serious implications for human security and development and heightened concern about political stability in countries that had been severely affected by civil war. Initial attempts to contain the Ebola epidemic were delayed and disorganized. Fears of local, national, and international spillover showed the need for more effective approaches to prevent and to manage health crises. With this project, DCAF and the Global Health Center brought representatives and experts from the health and security sector communities together to find ways in which lessons could be found from the Ebola crisis to prevent future health crises and avoid human suffering, maintain security and stability, and enable paths to development and good governance. The relevance of this new publication does not escape us today. It serves as an important reminder of the key role that security sector can play in the provision of public health. We'll kick off our discussion with introductory remarks by the DCAF director, then presentations by 4 panelists. We will follow the presentations with Q&A, so please type your questions into the Q&A box. The chat can be used for any comments, and don't forget to select panelists and attendees so that all the attendees can see them. Please remember as well to keep your microphones muted. This event will be recorded and made available on the GHC event webpage and on DCAF's website. I'd like to now introduce Ambassador Thomas Gerber, Director of DCAF. Prior to taking on the leadership of DCAF in 2015, Ambassador Gerber was Switzerland's Deputy Permanent Representative to the United Nations in New York. From 2007 to 2010, he worked as a counselor for financial, budgetary, and institutional issues at Switzerland's permanent mission in New York. The floor is yours, Ambassador Gerber.
Thank you, Anne. Excellencies, ladies and gentlemen, dear colleagues, on behalf of DCAF, the Geneva Center for Security Sector Governance, a very warm welcome to all of you to the launch of the book, The Security Sector and Health Crisis. Ever since DCAF was established 20 years ago, our organization has been dedicated to improving the security of states and people within a framework of democratic governance, the rule of law, and respect for human rights. We assist partner states and international actors supporting these states to improve the governance of their security sector through inclusive and participatory reforms based on international norms and good practice. As part of our core business, we create original knowledge products, and the new book is a very good example of that, promote norms and good practices, provide policy advice, and support capacity building of security sector stakeholders. Today, we are very happy to present our new book on the security sector and health crisis, which is the culmination of a research project with the Global Health Center of the Graduate Institute. Since 2014, this project has produced several workshops, seminars, and a series of policy briefs and reports. The book and its lessons could not have come at a more appropriate time. It's only a few weeks ago that the Ebola virus has re-emerged in Guinea for the first time since 2016, providing a stark reminder that the experiences reflected in the book launched today are far, far from being past episodes, and that we must not forget any of the lessons learned during the period covered by the book. An even more powerful reminder of the relevance of the book's topic is, of course, COVID-19. As has been the case for most, if not all, of our, and also your organizations, I guess, many of DCAF's partners have been operating in extremely difficult, challenging, even unprecedented circumstances during the ongoing pandemic. All over the world, security institutions and personnel have played a key role in mitigating the devastating human cost of the COVID-19 pandemic. As governments quickly formulated measures to manage and contain the pandemic, they called upon security providers to act beyond their usual roles and responsibilities. The strong capabilities in crisis management, logistics, and medical support of security institutions were mobilized for response measures, putting security forces in much closer contact with local communities than normal. This comes with certain risks, and it is also underscored by the importance of public confidence. Security forces can only really be effective if they enjoy public trust, if they respond to all the different security needs present in the population, if they are held accountable by oversight bodies, and if they cooperate closely with their partners in the health sector who are doing their utmost to prevent and contain the health crisis. The Ebola epidemic, and now again the COVID-19 pandemic, revealed and exacerbated inadequacies in security and justice systems, and in certain cases highlighted the need for reform. I would like to conclude my comments by thanking the Swiss Federal Department of Defense, Civil Protection and Sport for so generously funding this research and related activities which informed this particular publication. And specifically, I would like to thank all the 30 contributors to this volume for sharing their experiences, insights, and lessons with us. I'm now looking forward to receiving a taste of the book, because I have to admit I haven't fully read it, by listening to our speakers and the discussion afterwards. Please make sure to download the book and to share it as widely as possible with your colleagues and within your networks. Thank you very much for your attention, and over to you, Anne.
Thank you very much, Thomas. I'd like to introduce the next two speakers who together conceptualized and directed the project behind the book and served as editors and authors of the summary chapters. Dr. Albrecht Schnabel is the head of the Asia Pacific unit at DCAF. From 2008 to 2016, he served as a senior fellow in DCAF's Policy and Research Division, focusing on security sector governance and reform, particularly its development and post-conflict dimensions, and since 2014, its role in preventing and managing health crises. In 2017, he initiated DCAF's Asia Pacific Security Sector Governance Network with partners and experts across South Asia, Southeast Asia, and East Asia. The network partners currently analyze their respective national security sector roles in responding to the COVID-19 pandemic. I'd also like to introduce Dr. Ilona Kickbusch, founder of the Global Health Center at the Graduate Institute in Geneva. Her expertise includes the political determinants of health, health in all policies, and global health. She advises on global health strategies, trains health specialists, and is involved in the German G7 and G20 health activities. Dr. Kickbusch publishes widely and serves on a variety of commissions and boards. She is a member of the Global Preparedness Monitoring Board, co-chair of the UHC 2030, and the Lancet and Financial Times Commission on Governing Health Futures 2013, Growing Up in a Digital World. During her distinguished career with WHO, she served as key instigator of the Ottawa Charter for Health Promotion and WHO's Healthy Cities Network, and remains a leader in this field, most recently advising WHO's activities related to health and the SDGs. She was previously director of the Global Division at Yale University School of Public Health. Over to you, Ilona Kickbusch.
Thank you very much, Anne. Thank you very much, Ambassador Gerber, and thanks, Albrecht. It's wonderful to be together to finally launch our book. And of course, it's a great pleasure for me to also say a welcome on behalf of the Global Health Center. You heard that I had founded the center. It is now run by two new co-directors, Suri Moon and Vin Kim Nguyen. And we have continued to keep a focus on global governance for health and the training of those who have to negotiate for health in a global international system, and have therefore had a very strong focus on global health diplomacy. What we're particularly interested right now as a center is the enormous power shifts we are seeing in global health. And I think particularly now during the COVID-19 pandemic, we are experiencing a range of these geopolitical power shifts, but also we're seeing power shifts between different actors and stakeholders within the health sphere, but also within the security sphere. And this is an issue that we will continue to also look at in the Global Health Center. So for us at the time, it was a particular pleasure to come together as neighbors, physical neighbors, actually. We were able to visit each other by just walking into one of the next buildings that you see behind Albrecht on his picture. And to try and bring together also the health and the security sector. And of course, as we heard already from Ambassador Gerber, the presence of the security sector was perhaps more visible during the Ebola outbreak at the time, also because foreign military forces also came to support the countries in West Africa at the time. Then right now, it frequently is during the COVID-19 outbreak. But what we also saw as we were discussing with many colleagues from the health sector, that they had a very narrow understanding of what actually constitutes the security sector. So you say, you know, health security, and they think of the military. They don't necessarily think of the police. They don't necessarily think, for example, of customs officers. And I think right now, during the COVID-19 pandemic, we have seen how important and to some extent much more visible those parts of the security sector are at this point in time. And for anybody living in Europe, the importance of customs officers and border police has become very, very visible at this point. We've heard it's taken us some time to do this book, but there is always serendipity. Ambassador Gerber made reference to that actually, if we had come out with this book at a time when nobody was thinking of a global health crisis, it might not have garnered the attention that it's going to get now. And sadly, that is so frequently the case. You mentioned, Anne, that I'm a member of the Global Preparedness Monitoring Board. And one of the things we have drawn attention to is this constant up and down of crises and neglect in relation to global health crises. And if there is no crises in which we are in at one point in time, talking about regulations, about roles, about infrastructures for pandemic preparedness and response is not very popular. It seems that both the national community, the regional policy community, and the global community, as we call it, always tend to get active during a crisis. And now, very sadly, we are not only within the COVID-19 pandemic, but as the ambassador alluded to, we are already again in a difficult situation in relation to Ebola, both in Guinea and DRC, but also great concern of the neighboring countries. Now we can start to see some parallels also between the Ebola crises and the present COVID-19 pandemic, where we could say, you know, if you had only listened the learnings from the Ebola crises, you would not have encountered certain problems when you were confronted with the COVID-19. Actually, one of the features we see is that countries who have lived through a global health crisis or a regional health crisis, let's take Ebola, let's take SARS, are actually better prepared for other crises. We've seen that with Asia, much better prepared for COVID-19 because of their SARS experience. We've seen it with some of the countries in Africa, for example, who, with all the experience they had from Ebola, for example, in relation to social distancing, to testing and tracing, to a whole range of other factors, were able to respond in a more prepared way to COVID-19, despite having weak health systems, than maybe some of the European countries who, and this has always been a great concern to the Global Preparedness Monitoring Board, that there has been a tendency in the wealthy countries in the global north, if I can be simplistic, to think that health crises are always somewhere else. You know, they're in Asia, they're in China, they're in Africa, but they're not going to hit us. And therefore, sadly, the learnings, and also some of the learnings we put forward in the book, both for the health sector and the security sector, have not been listened to sufficiently. And the ambassador mentioned the issue of accountability that we also raised so strongly in our recommendations for all sectors. This accountability is going to be absolutely central as we revisit COVID-19, and the accountability not only of the health professionals, of the security sector, etc., but actually of the political decision makers. Now, with Ebola, we have moved one step forward, and that is we do now also have an Ebola vaccine. And you can see that similar discussions around the financing, the production, the procurement, and the process of vaccination, of making accessible the vaccine to the populations, is just as important in the Ebola outbreaks now as it is in the COVID-19. And here again, you know, we see a very discouraging development in terms of the global geopolitical arena, is that we have a form of vaccine diplomacy that is not oriented towards us solving this crisis together as a global community. And we have a mechanism for that now, COVAX, but that actually we are using, and this takes us into the security sector in a new way. Many countries are using the vaccine for geopolitical gain. And this approach to the geopolitics of vaccines is adding a new dimension also to the whole health security debate. It is also adding new dimensions because we can see biosecurity issues entering the discussion around the origins of COVID-19. We clearly see issues around intelligence gathering, about transparency of sharing the origins of the virus. We can see very clearly that the approach between countries and the trust in vaccines in relation to different countries where they come from is also influencing the relationship between countries. And I think this development that we are seeing also, for example, not only with false information, but with false vaccines, actually a vaccine mafia is starting to be created. That takes us back also to other areas of the security sector. Finally, I'd like to say that if we take this time span from our book, a little bit earlier from our book and to now, we actually can see a major mistake. We see that as a global community, we have looked at each of these events separately. We have not looked at them as actually a systemic crises and risk event in our new global world. If you look back since the year 2000, we have had SARS, Zika, MERS, we've had a new polio increase, we've had Ebola, and we now have COVID-19. And we have to start seeing this, and we have said this from the GPMB, as as a whole, we have to see that the whole world is challenged by these new security risks in a new way, and that we will only be able to respond if we see this as one. One of the most interesting concepts around this has actually come from the security sector. And I must really congratulate the security sector on that. The Munich Security Conference, some of you might know this, published a really exciting document a couple of weeks ago on polypandemics. And it tries to show both how we have to see these many pandemics as one, but it also shows that a pandemic is never only a health crisis. It's a social crisis, it's a security crisis, it's an economic crisis, and that therefore anything we do needs all sectors of societies to work together. So I would like to say, irrespective of a whole range of very specific recommendations that we have made in our book, there is one that is absolutely critical from this perspective, and I would like to end with that. There is the very, very clear message that even with a view of polypandemics, the response to pandemics, to all measures, must always remain under civilian control. We have seen that there are dangers when there are autocratic responses to the virus. We have seen that autocratic regimes have used it to control people, to surveillance people. So a whole range of other security issues have entered the COVID-19 control, and the ambassador has said we can only really successfully fight any kind of outbreak if there is trust in government, if there is trust in the actors who are involved, and also, as is the case in many democratic countries, also trust in the security forces of those countries. And that, of course, takes us back to the ultimate reason why DCAF exists, to see the security sector as an integral part also of a democratic society, of democratizing societies. And this is one of the challenges we are also looking at the Global Health Center right now, the interface between democracy and health. So I'd like to thank you very much. I think issues that we've raised in our book and recommendations are as important today as they were when we discussed them. And actually, they have now gained an additional importance. And I hope we will have an opportunity to discuss them further and maybe explicitly try and do a comparison between our Ebola recommendations and what we are experiencing now with COVID-19. Thank you very much.
I'll invite Albrecht Schnabel to speak next. Thank you, Albrecht.
All right. Thanks, Anne. Thanks, Ilona and Thomas, for your introductory words. I mean, I'm also very happy for the opportunity now to launch this book that we've been working on for quite a while, and share some of its main lessons and pick up where Ilona left off, and those were you know, some comments on how all of this concerns the security sector. During the preparation of the book, it became clear very quickly that many of the recommendations that emanated from the Ebola crisis are still equally true now, and are actually in desperate need of follow-up. And this especially when it comes to some of our main recommendations for more meaningful, for more effective security sector involvement in health crisis. So before a health crisis, states must improve their preparedness, you know, for coordination, for implementation of successful emergency responses. And here especially cross-sectoral cooperation is important in anticipation of emergent health crisis. Then during a health crisis, the speed of the response is really critical. So the speed will depend on the rapid availability of sufficient health workers and security personnel that are also trained for this cross-sectoral cooperation in health crisis. And after health crisis, post-crisis reconstruction of infrastructure, of health systems is needed to ensure preparedness for future health threats. So lessons learned during the crisis in all aspects, including civil-military cooperation, information sharing, border management, and regional cooperation capacities must be integrated into training, then into early warning systems, into guidelines and frameworks that govern health crisis responses by national but also international actors. And so please allow me to highlight a sample of recommendations that came out of the study when it comes specifically to the security sector. So clearly, preparedness is still quite weak and must be improved. So research should be undertaken by all security sector actors on the impact of health crisis on their own roles, their own responsibilities to prepare better for possible outbreaks. And here drawing, of course, on the experiences with the Ebola epidemic and the ongoing COVID-19 pandemic is crucial. And as Ilona said, many other health crises that have happened previously. Then national armed forces in both the countries that are affected and those that are offering assistance must be trained for their potential involvement in health crisis outbreak control. So armed forces must be ready to assist as soon as an outbreak occurs. They must be mobile, well equipped, have the ability to concentrate materials and resources where they're needed and for what they're needed. Alongside epidemiologists, military officials should take part in regular forecasting briefings because coordination and synchronization of early preparedness is critical in assuring an adequate readiness and response capacity. Then police services, must be adequately trained to participate in responses to health crises, including interoperable collaboration with the health sector, international actors, and of course, other security sector actors, including the military. So police and other security actors must prepare for future health crises by stockpiling sufficient amounts of personal protective equipment, be trained on how to use those in case of emergencies. It's important to ensure that the actions of police and other security forces don't threaten human rights and the credibility of their participation in the response. So, for example, through community policing, police forces can contribute to the dissemination of information and thereby sensitize the population to the dangers that exist from health threats, like infectious disease outbreaks. And here the specific needs of vulnerable populations, like children, pregnant women, the elderly, and people with disabilities must be taken into account. And there must be a gender balance in the deployment of security personnel. And time after, this has been shown to be very important when, for example, taking temperatures or other measures that involve people's bodies, and touch on cultural and religious sensitivities. It is important that when the challenges go beyond traditional security tasks, non-civilian security institutions' involvement must be subsidiary to the civilian actors that are directly responsible. And that's something Ilona has just pointed out as well. So military and police must fully understand and respect their own subsidiary role under civilian leadership of health crisis management. Then a free flow of information is essentially for security sector actors, especially for intelligence services and border management. To support, for example, integrated border management approaches, regional information sharing is particularly important. This also requires cooperation of border police, customs services, intelligence services, and medical and also veterinary components, and that must be scaled up and improved. Then there's a role for international and regional organizations who should work on improving preparedness to deploy health and security specialists more quickly to areas that are affected by health crisis outbreaks. Warning mechanisms and standardized status of forces agreements must be improved. And so-called first entry agreements that cover issues like strategies, funding, human resources, and sharing of responsibilities need to be fully pre-negotiated and then signed to allow them for rapid deployment when the health crisis breaks out. And of course, scenario analysis and simulations should be part of those preparations. Then accountability mechanisms must be strengthened and brought on board when security forces prepare for more effective and accountable health crisis responses. Here, parliamentary oversight committees must be strengthened and capacities must be improved, especially on the linkages between defense and health security issues. Independent oversight bodies like human rights commissions, police complaints bodies, intelligence oversight bodies, or defense ombuds institutions need to be strengthened because they play very important roles in providing complaints mechanisms to affected individuals and in exercising control over security institutions. Ideally, an accountability mechanism should be established for security sector actors that are involved in health crisis and include representatives from civil society, from academia, and independent experts to assess national, regional, and global responses to major public health emergencies. And importantly, also legal frameworks must be revised to reflect the role of security institutions in health crisis. Now, the Oslo guidelines are a good example for a good framework for military involvement in such crisis. But a framework must cover all components of the security sector and then also be adaptable to different contexts and different countries. And then, of course, internal doctrines and manuals of security institutions need to be adapted to these international frameworks. And finally, I want to conclude with just a couple of recommendations for security sector reform activities that are either already underway or that are being planned. And those activities should include capacity building for managing health crisis and interagency cooperation inside and outside the security sector. And that is important to build trust among civilian actors. Then national security policies and their implementation strategies, they must reflect the risk and the impact of potential health threats and the contributions that the security sector can make to mitigate them. Then security sector reform must address gender issues to ensure a gender-sensitive security sector and also facilitate cooperation with health sectors that in many countries are far less dominated by men than their security sectors. And finally, health crisis preparedness must be mainstreamed as a component of security sector reform activities to prepare security sectors to play constructive, effective, proportional, and accountable roles in the prevention and also in the management of major health crises. So thanks a lot, and over to you, Anne.
Thank you very much, Albrecht. Our next speaker is Dr. Prosper Addo, Senior Political Officer at the African Union Liaison Office in Khartoum, Sudan. Dr. Addo served previously as Senior Political and Humanitarian Affairs Officer at the African Union Liaison Office in Monrovia, Liberia. He also worked as a research fellow at the Kofi Annan International Peacekeeping Training Center, KAIPTC, in Accra, Ghana, and as a research fellow at the African Security Dialogue and Research Institute. He's widely published, with his research focused on conflict, peace processes, and transnational criminal activities in West Africa, as well as on security sector reform, small arms, and light weapons. Dr. Addo is author of the chapter, The African Union's Contribution to Eradicating Ebola in the Mana River Union Subregion. His presentation will be on lessons learned on cooperation between health and security sectors during the Ebola crisis and implications for COVID-19 crisis response. Over to you, Dr. Addo.
Thank you very much, Anne. And I'm glad, to be amongst all of you. And I would like to start by making some initial statements, which then prepares the ground for me to look at the lessons learned aspect of the cooperation between the health sector and that of the security. And then, of course, what implications would be there for COVID-19 in terms of responding to the crisis. So I'll then begin by saying that the presentation I'm making is purely from my personal observation. From my perspective, it does not represent the African Union in any way. I played a very effective role when the crisis was ongoing between 2014, 2015. And it was an interesting time. And when this crisis broke out, it was to the extent that one could hardly even know what it's all about, like we had in the case of COVID. But then there was a need to quickly respond because there were lots of deaths taking place and all that. And that culminated in the continental organization, the African Union, having to rally support from across the continent and beyond in terms of concrete responses to alleviating the death, the suffering, and also eradicating the EVD. And so that was very important. Again, the mission that was deployed, which is the African Support to Ebola Outbreak in West Africa mission, we call it a COA, had a combined effort of both civilian and military. And as was alluded to by speakers before me, they really had to partner to ensure that EVD, that's the Ebola virus disease, was eliminated. And I think that partnership was crucial at the time to establish the exact objective they intended to achieve. And then, of course, there were many lessons learned, which I'll be touching on a bit, but also that the policy process was very important, at least from the African Union side. And given the bureaucratic nature of that process, Albrecht talked about the fact that responses and preparedness has to be timely. And given that we did not understand the dynamics of EVD at the time, it took a bit of time for some concrete action and deployment. And so that's also important that we keep in mind. And of course, when the mission was deployed, I saw a mission in the Mano River Union sub-region, in Liberia, in Sierra Leone, and of course in Guinea, we had challenges on the ground, which had to be dealt with. And so from my lessons, I'll tease out some of these and how perhaps we can respond to them going forward in future in cases of other, global health crisis. Of course, the issue of resource mobilization was key, because without that, it was going to be difficult for any kind of intervention. And here I must say that it was really interesting to see that apart from state actors, sub-state actors, African civil society groups, and all these others contributed towards supporting the process. And that commitment and dedication, I think, is very key and must be taken note of. And then, of course, we also had some issues, cultural issues, contextual issues. The virus was not like the airborne type we're having now with COVID. It's a touch. And once you shake somebody, within 4 days, the person is gone. And this was how serious it was. But of course, people's culture and the way they go about their activities necessitates that people greet each other, they hug, they do that. How to get people to stop that habit was very difficult. But of course, if you deploy people from other African countries who had knowledge of the context and all that, it made it easier for them to explain in a way that they can relate with, either in Liberia, Sierra Leone, or Guinea. Though it wasn't easy, but eventually when the message got down and people noticed that families were being wiped out, it helped a lot in addressing the situation. And then of course, one would not leave out effective partnerships and collaborations from the African Union, the ECOWAS, West African Health Organization, WAHO, who also deployed members side by side, the AU health volunteers. Cuba was also there with the AU volunteers in the Ebola treatment units. You would have all the experts around, but when things were happening, it was difficult to get people to work in the ETUs. And the volunteer health workers did a fantastic job, particularly as they had expertise in DRC, Uganda, and other places. And their contribution helped, stem the tide. And I think in this regard, they did a very good job. Of course, you had the United States government providing logistics. They brought a whole troop in terms of moving resources here and there. And that brings out the partnerships that we're talking about between security actors and health actors, and so that was laudable. China also provided health workers to also work in the ETUs as well. And then the list goes on and on and on. And of course, you had the CDC there, the MSF, Medcal, Mondial, and all those other partners. We work closely together. And so it was important that this collaboration, happened to ensure effective response to the EVD. Now, having said that, I will then quickly move on to tease out some of the lessons that were learned, as a result of the cooperation between both the health and the security actors, and how this can help improve responses to COVID-19. Perhaps the first thing I'd like to touch on has to do with Africa's ability to respond to pandemics or humanitarian challenges from both state and sub-state actors. And I think in Ilona's presentation, she made mention of the fact that as she was talking for COVID-19, given that there had been some expertise and experience and all that, people were able to observe social distancing much more easily and handle the situation well. So the key lesson there is that the health personnel that were deployed from all over the continent had the expertise. And when they arrived, there was one interesting development, which I must mention. Health workers were just dying. They were dropping dead. And they were still using all the, how do we call it? The PPEs and all that. And so at one of the training sessions, one of the AU health volunteer got up and said that what was causing the problem was the fact that they were not handling the glasses or whatever they used very well, to the extent that the infection of the health workers was coming mainly from the way they were using their fingers, on their eyes and all that. When that observation was made and they stopped, it was totally a situation where everything became normal and health workers did not in any way suffer that lesson again. So I think that that's a very laudable thing. Again, despite the deadly nature of the disease, the dedication, commitment, resilience shown in containing the EVD based on the shared values and norms of African solidarity, unity, and integration was very key to the process. It really helped go a long way. Because then people were not willing to go there because of the nature of the disease, and they were scared to intervene. There was also the issue of better preparedness and rapid responses, which Albrecht mentioned, and this really needs to be improved. And in doing that, I think that better preparedness would come from the coordination, collaboration, and cooperation that is needed at various levels, at the national level, at the regional level, continental-wise, and even global, so that security and health workers can partner and work together to ensure that there's rapid response. And so this certainly would be essential. And as we can see in the COVID-19 situation, we had all these workers, both the health and security workers, working side by side in certain cases. And so I think that that is something that we have to take into consideration. And then, as I bring my presentation to a close, I'd also want to touch on the issue of African, the experience, the expertise, the better appreciation of the context and professionalism that the volunteer health workers made to the whole intervention and response in containing the virus. But more so, just to touch on now the issue of the health actors as against the security actors. They all have their roles and their responsibilities. And there are cases where the civilians would have to take their lead, as was mentioned, and there are cases where the security have to take a lead. In Guinea, volunteer workers came under attack because they were being accused of propagating false messages. And when the team was deployed, they had some military among them. They helped in the planning of the CONOPS, which is what helped guide the implementation of the whole mission. But these military were not armed or trained in any way to work side by side the volunteer health workers to ensure their safety and security. And so it became obvious that the volunteer workers had to call the national authorities, the police, to come in and protect our health workers. So such partnerships are crucial, because then you have to go to an environment to go administer a vaccine or something, and you suddenly come under attack. So you have that. And again, the issue of training together and capacity is very crucial, so that when there are these prior training before deployment, interoperability becomes much more easy, as Albrecht mentioned, and they know how to work all together. And I think that in all these interventions, it's important to mention that there was no single case of infection among the AU volunteer health workers. And this really is a plus, because it all stemmed from the expertise and all that. And finally, the issue of acceptability and building of trust and partnership was crucial to make this work, because then those in Liberia, in Sierra Leone, in Guinea, who saw the volunteer health workers had some level of acceptance for them. And it made it easier to convince them to observe basic protocols. So in a nutshell, these are some of the lessons that we teased out, particularly in my chapter that came out. And I think that going forward for the for the COVID-19, it will be important to make sure that the health sector engages well with the security sector, and making sure the partnership goes to address the effective responses, the timeliness of the interventions, and also sensitize in a way that people can understand the whole process and help eradicate the COVID-19 disease as well. So thank you very much for the opportunity.
Thank you very much, Prosper Addo. Our next speaker is Dr. Christian Hagenmiller, health security researcher at the German Institute for Defense and Strategic Studies in Hamburg, Germany, and a lecturer at the Bundeswehr Command and Staff College. He initiated and leads the Comprehensive Medical Support in Complex Emergencies course at the Kofi Annan International Peacekeeping Training Center in Accra, Ghana. He is a member of the World Health Organization's roster of experts specializing in public health emergencies. Previously, he was an analyst at NATO's Joint Analysis and Lessons Learned Center and worked in intensive care unit of the German Heart Center in Berlin. Dr. Hagenmiller is the co-author of the chapter on health emergencies and crisis training modules for health and security agencies. His presentation will be on the lessons learned from integrating crisis management training for health and security actors during Ebola crisis and lessons for COVID-19. I believe we have some slides now. We can go over to the PowerPoint.
Thank you, Anne. I hope the slides are showing up.
Not quite yet, but coming, I think.
It's coming. Okay.
Voila.
Now it's there. Okay. Yeah. Thank you. Thank you. Yeah. Thank you so much for having me. I think one of the reasons why I was invited to be part of this writing team was because I was part of the lessons joint analysis lessons learned from NATO, I just will do that here. Maybe it's better. And those lessons that I have collected so far over a long time, there was a pattern in civil military interaction, specifically in the field where military are engaged in supporting healthcare systems, or involved just in providing healthcare in a conflict environment. And there was a pattern that was reoccurring mission by mission. And even though that those lessons that I'm just showing here, and these are just nuggets, it is interesting that still that it's over 10 years ago, they still are as let's say current as ever. So we can see a lack in coordination still, because we are missing some mechanisms in place, or just also overarching mechanism. We see, of course, some fluctuations here, that there are some step forward. I'm also part of the UN SimCourt, UN OCHA SimCourt officers course, and so we were also teaching that that coordination is key, and you see improvement, but it's case by case, and in other missions it's also you see that this is not sustainable. We see also that information is a key area where some lessons or some pitfalls here are really being having a massive impact on the collaboration or cooperation amongst civil and military actors. And it's not just civil military, it is also, as it said, it is the security sector interacting with the civilian ones. And certainly because it's lack of trust in protecting data and reluctant in sharing that with other institutions. We have to say as well that governance is also a part of the problem that needs to be addressed and has to be seen without blaming any country, or there's let's say if it's a part of the a Western world, or the global north, or against the global south. It is, you can see that in every country, even in Germany, we can see those lessons that we have that needs to be mentioned and also learned. Lastly, we see that prevention is a very that is the low-hanging fruits in the whole crisis response, and where we do not have, where, let's say, the crisis that prevention are really often neglected compared to the response activities of the international community. And let me share also some observations that we have in that that are sparkled in the entire book. It is fascinating to have a really now reference here, because getting so many perspectives from different countries, from different organizations, and really sharing their lessons, it is a really piece work that is exceptionally important. And it's just without any order and without any ranking, but there is just the problem where the intersection about where security and health are really showing up very often, and it is where the security actors in sector really lacked specific capacities. For example, here in detecting and surveying the health crisis. We saw as well that the border policing were also part of the problem. And also here, I can also say that even in Germany, we had that kind of, let's say, we can draw some lessons here. We're saying, okay, that integrated border management might require some updates and plugins just to be much more cross-governmental and include the whole of society approach. And we were mentioning that the civilian is in the lead, and this is true even for the Ebola crisis 5 years ago, or now here in COVID. But there is also that notion that the military are the ones that are really, they have a capability, and this is just to act fast, to adapt quickly, and that might be also causing some problems in pace and understanding if we are trying to synchronize our efforts. Another theme that came up, and I think it's should be highlighted here as well, is just that the ties, the historic ties from nation A to a nation B, and either it's historical or just a newly discovered strategic of a strategic importance. That relationship is really something that are enabling the response and can act as a very, very good entry point. And we need to phrase that, because diplomacy at that in this stage is always part of let's say of the whole disaster response. And very interesting as well to see how the international health regulations really came into trouble when now nations started to do their travel bans, and with good reasons, but also in reducing the mobility of their population, and so also impacting the right of free movement. That was also very, very interesting to see, where security is much more than just military. It is a whole much wider endeavor that needs to be addressed. And as Ilona Kickbusch also mentioned that in her interest in her statement just at the beginning of the presentation, there are a couple of other observations that are really disturbing, and those are just the deliberate misinformation and disinformation that we might say it's not just bothering and having an impact on creating confusion. It really was part of a kind of warfare in certain ways. For example, NATO had were facing really some issues. Everybody knows that there was that very sensitive accusation among the Chinese, among China and also US, including Russia, where the origin of the virus was just a kind of reason to have serious disputes and was fueling a certain conflict. So that certainly needs to be mitigated in some way. Also, we saw a dramatic increase in cybercrime, specifically on healthcare institutions. There are many other reasons why that happened, but this happened during, also that was catalyzed by the COVID-19 epidemic. We see as well that violence is just one of the area that increases as well. Very silent, neglected, and not making up into the news, because this is the domestic violence, but also criminal violence that are now flourishing because just security actors are just they need to have other priorities occupied with different other missions, and also it has an impact on security missions, or UN missions, and also other stabilization missions that are across the world, because the fear, not only the fear, but also taking some activities to that the military deployment was hampered by quarantines, and also trying to protect their specific not only the health but also the spread of the viruses. So, but we also saw very nice training examples that occurred during those times, either also in West Africa, but also right now. And this is really boosting capacity building, specifically in very, very interesting areas like strengthening the biosecurity programs here in the Sahel zone. There was also disaster preparedness programs, programs just to train how to use PPEs, personal protective equipment. That was extremely important just at the beginning of the Ebola crisis, where that was a big issue. And here civil military programs were seen in many nations. And also lasting medical training for health workers that also occurred on let's say on a sustainable online training platform, and that is something that we could see in specifically in West Africa, but also now in the COVID-19 crisis. So before coming to a conclusion here, I also just want to mention that health surveillance was or is a very specific part where joint effort can occur, and not only can but requires, because we just know that nations were just also reluctant in sharing their actual numbers, specifically also from Ebola and also in COVID. we can, there are different reasons why that happened. Some because they feared some specific consequences if they shared their real numbers. And some really was because they didn't have the system in place to capture all those numbers. But this is just a fact that we were having probably issues to get the real picture. And also that the disease surveillance still focusing on the human cases rather than just looking at the whole chain of infection. And here I just want to drop the keyword the One Health approach, including the whole animal sector, food and agriculture environment that also is just a big part of, let's say, of a disease surveillance and getting the information that something is occurring. So bottom line is that we have here definitely a very, very interesting complexity of a situation where we need to understand let's say the origin of emerging health crisis, and that this requires just a multinational approach, which in turn, of course, requires expertise from the health and the security sector, and also that this is just at the beginning that we see. And here what we need is to have a much advanced, a comprehensive near real-time disease surveillance system that include just the multi-hazard assessment from other traditional epidemiology, and also generated and access to common situation awareness and early warning. So this is very fundamental and very important if we want to move forward to address this. The second is to have continue to foster the interdisciplinary cooperation among the different stakeholders, just to improve preparedness, and lastly also a proactive risk communication, just to counter the new let's say threat that we see in misinformation. I would really see that Ebola was the Ebola crisis was still in the analog phase, and with COVID we really entered in the digital phase here, that requires also an upgrade in the whole health intelligence domain. And so what are the recommendations that we can pull out here is and this is, I have to say, I mentioned that in the chapter. Nevertheless, this is probably also pretty bold to claim that, but we really need, and I really want to advocate for this, to have an independent lessons learned system, and a system that is more than just, please forgive me, a written a collection of lessons. System means that it's something that gets the information, not only analyze that, but also feed the whole community. And feeding the community means that there is specific and strong links to the main stakeholders, such as WHO, World Bank, UN system, agencies, and also other and the national ones. One thing is that military, they have lessons learned systems in place, and so we need also to foster that the military to military health security engagement activities are also sharing that. but also dropping that to the civilian ones. The second is just to have a multinational health cluster, not only health cluster, but academic cluster, just to draw and to do something out of that what we have gained so far. So developing content for academic programs, continue research and analysis. This cluster is really something that might change and is complementing the substantial lessons learned system. And I think this book is really a baseline for this, and this is a very, very good example how this what we can do. And of course, we need to stress that the country's ownership needs to be on top, and we need to find venues how to support that. It's not enough to draw some conclusions and recommendations from one area of a continent to another one. So there needs to be a local and country ownership, and this is why it's a whole of a very global endeavor. What we are looking here to continue. And just to finish with the course, what we have now in Accra, in the Kofi Annan International Peacekeeping Training Center, it is partially addressing that and partially starting that kind of, let's say, movement. And I would really look forward to expand that kind of idea, how to promote this training, because training is preparing, and preparing is exactly what we need. On how we can move forward in increasing the collaboration with different institutions. And I will stop here, and I'm ready to take any questions. Thank you.
Thank you very much, and thank you to all the panelists for these rich presentations. We do have some questions, so we're going to go right into that. I'd like to first take a question from my colleague, Victoria Walker, who is asking, can the panelists please share any insight on the extent to which the improvements in interaction and coordination between the security and health sectors 4 to 5 years ago during the Ebola crisis were sustained after the health crisis? And what were the key drivers to ensure that sustainability? I'd like to perhaps put this question to you, Ilona Kickbusch.
Well, from the side of the Global Preparedness Monitoring Board, I would say we have not seen as much sustained cooperation. There has been great concern in the public health community about some of the effects of what is called the securitization of health. And during the Ebola crises, a whole number of working groups were established, but it sort of tapered off. I'm not that informed about, and I hope one of the security colleagues will answer that, to what extent it has become much more regular for them to include the health sector thinking. We have been very worried that, particularly during COVID-19 and particularly in our part of the world, that many of the actors in the security sector were not, or these sectors, the police sector, the border police, the customs sector, were not trained around health issues to understand them, to be able to respond appropriately to them. You can't just, and we see that also policing social distancing or things like that. You can't just do that like you police somebody who's smoking a joint where he shouldn't. So these kinds of things have not been prepared, and that's why we've introduced this terminology of, being pandemic proof, in a sense, really in the general training of personnel and in the way your system is organized to respond, you need to factor in a health crisis. And you need to factor in the kind of things that will be regulated, that will need surveillance, that will need oversight. I mean, also think of the whole issue of policing quarantine. Most countries were not prepared, you know, how to use the police. Who should police quarantine? Should it be the public health people? Should it be the normal police? If the people have come from abroad, should it be the border police? You know, all these things were not thought through. And linked to that is one key issue where we've really had a problem, and from the health side, and I'd love to hear from the security side, is most of our rules for health crises are short term. We sort of have this notion, you know, a crisis, how long will a crisis take? You know, a couple of months, okay. And actually often one hopes it's even shorter. And already there was much worry that the public health emergency of international concern for Ebola, for example, needed to be upheld so long. And so now, you know, we have a public health crisis over a year now, and all our systems are not prepared for the length of the crises. How do you keep up the responsibilities and the response? So I would say, you know, we haven't really been good at it, at least in our part of the world. And we really, really have to learn.
Thank you. Perhaps one of the other panelists would like to come in with some insight on the security sector side.
Well, perhaps I can say a word or two. I mean, I clearly agree with Ilona. It's quite disheartening that there hasn't been a lot of improvement. I mean, back then I remember we had a policy brief and we said, you know, Ebola is a wake-up call. You know, things have to move, things have to change, and so on. And that hasn't really happened. Also because, and we've seen that with our work as well, interest in the crisis and potential responses disappeared very quickly. One moved on to kind of business as usual. And then on top of it, perhaps one should also mention that the Ebola crisis was in a way very localized, you know, and didn't affect the rest of the world beyond West Africa, certainly not to the extent that COVID-19, you know, was a global pandemic. From that perspective, I mean, in a way, COVID-19 is another chance to have another wake-up call and really get serious about some of the lessons that have been learned by us, but by many others as well. Thanks.
Maybe I just would want to just add, in terms of key drivers, I think the leadership issue is crucial. There were cases where security people wanted to do it this way, the health actors wanted to go this way. But the president then, President Sirleaf, had to call everybody to order and said, there's one chain of command, go through this channel. Where there's a need for any security engagement, you go through that channel because the security person then takes the lead on that. If it's a health issue, you go through that. So leadership is crucial and a key driver in bringing people together to even give information. If they don't want to do that, it has a way of fixing some of these problems. But then the other side of it is perhaps the issue of training, capacity building together. It must be a collective exercise because, as Christian mentioned, when they train together and learn together, they know each other's, what they do. It helps interoperability, and it also helps get a better appreciation of each other's task. And that diffuses the tension and allow people, to do things. And perhaps finally, there was this emphasis on the collective interest. Nobody is there to pursue a personal, agenda, to project himself or herself as the actor that is making A, B, or C. Everybody is contributing to the collective goal. So when you have those key principles and guiding, or guidelines, it helps make the intervention much more easier. So those are some of the things I would add to it. Thank you.
Thank you very much. That leads us really nicely into the next question from one of our audience members, asking that could the speakers reflect on how legitimacy and trust in the health working force, the health workers, can be blurred while working together with security actors. There have been episodes of violence or attacks against healthcare workers over the years, including now during the COVID-19 pandemic. There have been concerns about the securitization, even militarization of global health responses. How do we consider this? I'd like to, Christian.
Well, this is a very disturbing trend that we see over the last 5, even 10 years, that it's increasing. Attacks on healthcare workers, and not only healthcare workers, but just on any humanitarian aid, is just rising. And you can see that there are a lot of statistics. The problem here is a couple of years ago, I would have clearly shared the impression, yes, if there is blurring the line, there is that kind of, let's say, increased risk to be associated with a party of conflict, which means you are then a potential target for the other party of conflict. But nowadays, it is, I think, there are other agendas here, and they are not really looking, following that kind of strategy, and which means there is a lack of respect, just a lack of respect of the humanitarian principles, which can be shown anywhere, and the military, they have also learned their lessons in really trying to protect the humanitarian side, not to engage to, let's say, visible or aggressively to try to collaborate. It's much more to be in the background and to support from the behind the scenes. So those are the lessons, at least in many NATO countries, if it comes to complex emergencies. But we can really see that attacking humanitarian aid workers is just increasing, and the reasons are manifold.
I believe Thomas Gerber would like to complement that.
Well, thank you very much. And just to complement, indeed, from a DCAF perspective, we've made quite an interesting experience, in partner countries like Morocco, but others as well, where during this crisis, an emergency state obviously was put in effect, which redefined quite substantially the roles of the different actors, security actors, but also others. And often, what we felt is that incidents of dysfunctionalities, which have led to an erosion of trust, were also due to the fact that, there wasn't enough experience and knowledge about the limits and the boundaries imposed by these emergency states. So security sectors, actors, but also others weren't experienced enough and knowledgeable enough to interpret their new roles in a responsible way. So for us, I think a lesson has been that we need to anticipate and maybe develop protocols, to be prepared if such state of emergencies, are going to be activated, so that all the different categories of actors know more fully, what they're expected to do and how they're expected to behave. And that in itself, I think, can build a lot of trust, with the public and different groups in the society.
But if I can just add, and Christian alluded to it, and I'm speaking for our part of the world, is that violence against health workers and particularly violence against public health experts has definitely increased, and it's increased exponentially on the social media. People are threatened, scientists are threatened who are presenting a view that is not popular with some groups in society. We have needed, the police to protect key scientists because certain groups in society are attacking them. We have populist movements against mask wearing, and so we're starting to have violence of citizens against citizens. So a new dimension has entered here, which is definitely very, very disconcerting. We thought initially, these kinds of things emerge in countries that are in conflict, that have come out of civil war, all those kinds of things were discussed in the context of Ebola. And we now see that some of these things are inherent in our societies and that we have not found a way to truly handle them. And social media, infodemics, all this development is absolutely reinforcing it. And I tell you, the kind of attack some of my public health colleagues who make policy in quotes or advise politicians in their respective countries against threats against them and against their families, their addresses being made public, all kinds of things are just very, very disconcerting. And we have not yet found a way of handling that. Thank you.
I'd like to, actually, we probably have time just for one more question. And there's a question that's really related to this and flows from that idea coming from our colleague Paolo Costa, who writes, would it be fair to say that it was more difficult to respond to the current SARS-CoV-2 pandemic from the global north democracies due to the fact that citizens have higher conscience and feel stronger about individual freedoms and their rights versus the social or collective responsibilities and duties? So sort of a, versus a more autocratic political model. If this is true, what can be done in terms of a good governance perspective?
It's not true. Because different democracies have responded differently. And Taiwan is a democracy, South Korea is a democracy, Australia is a democracy, New Zealand is a democracy. So you have a group of democracies that have responded very well, that have been able to communicate very well with their populations. That have had great respect of scientific advice, of public health strategies. And we have had democracies, some of them flawed democracies, as the International Democracy Index identifies them, that have not dealt well at all with COVID-19. And again, it's not also just simply democracies that are rather centralized or decentralized, because, take New Zealand and Australia. Australia is very decentralized with very strong states, and still they have managed to find a common approach and, are more or less at very carefully said at zero COVID. And so it's not democracies versus autocracies. It's also about good governance and about how the interface of public health science and political decision makers are. That some democracies have had a difficulty in handling this is something we are actually presently trying to research, and why it is that some respond in a more solidaric way, because democracy is not just about individual freedom. It's also, about what we create together as an entity, as a country, as a community, a democratic community, and those where that has not worked. So I would just urge us to be very, very careful and not just juxtapose democracies versus autocracies, and not just juxtapose individual freedom versus some kind of notion that, you know, some people in Asia have a more collective thinking than maybe we do. And that's, by the way, what is wrong with the Economist Intelligence Unit's analyses of what has happened with democracies during the COVID-19 pandemic. That would be my answer.
And it's a beautiful way to wrap up, I think, this webinar. Thank you for so eloquently really tying this all together, Dr. Kickbusch. So I'd like to thank the panelists. The book will be available. There's a link, I think, in the flyer. It's on both of the institutions' websites. So I really encourage you to go and download it. I know there have been some questions about the presentations and so forth. So everything that can be shared will be put up onto the respective websites and should be available. So thank you again. Thank you, panelists. Thank you, Ambassador Gerber as well, for this really interesting afternoon. Bye-bye.